Are you feeling pain in the front of your shoulder when lifting, reaching, or working out? If so, it may be bicep tendonitis, and this video is going to be great for you. Welcome back, guys. It is Dr. Tom here, and we are going to look all at bicep tendonitis, and in specific, we're looking at the long head or the proximal part of the bicep tendon that attaches up in this part. So what is bicep tendonitis? Bicep tendonitis is inflammation or irritation of the bicep tendon. The most commonly affected area is the long head of the tendon, which runs along the shoulder joint and attaches to the top of the shoulder socket, or otherwise known as the glenoid. So what are the main causes of bicep tendonitis? So it's often caused by repetitive stress or overuse. Swimming, throwing, tennis can be included in those. Also repetitive pulling or lifting. Another big one is shoulder instability or rotator cuff issues. Other contributing factors can include things such as poor posture, shoulder impingement, and even age-related degeneration. So what are the symptoms? Patients often come into clinic complaining of pain, and pain that radiates from the anterior or the front part of the shoulder that can radiate down the arm. This can get worse with overhead lifting activities, can be worse first thing in the morning before they start to do activities. Also tenderness. So if you were to run your finger over the sore spot, it is normally quite tender. Weakness is another big one. Inflammation and swelling, especially in the front of the shoulder here. So it can be warm if you were to run the back of your hand over the area. Going from somewhere else onto the area, you might feel that there's a bit of a temperature change and it's a little warmer across that affected area. So if you think you're someone that may have bicep tendonitis, how do you test this? So a simple test can be to keep your elbows bent, make a fist, and then almost just do a little isometric curl. So trying to contract this bicep tendon. If you start to get pain pulling up into this region, that can be bicep tendonitis. And then the other test, a little closer, all the way up here, same thing. If there's pain in this area, a strong chance that it is bicep tendonitis. The last test we can do, lock the arm straight. We call this a speeds test. And keeping this elbow straight, we're just trying to resist, lift the arm, and the same thing. This will often go more so up into this area. And a positive test is pain and even a little bit of weakness on trying to lift. So what are we going to look at today, guys? So initially we want to lay off. So our early phases are to rest, ice, allow the injury and the inflammatory stage to pass so we can start to get some strength into it. Phase number 2 then comes in, and this is going to be the stretching phase. So the tears have started to heal. We want to start to get a little bit more length through the muscle belly, so then when we start to load it, we're not going to create those tears and cause them more irritation. And then, as I just mentioned, the last stage, stage 3, is the strengthening phase. And we want to go into this phase really slowly to make sure we don't reverse all the work we've done and go back to the start. So really, always in my videos, guys, the golden rule is there's a pain barrier. We don't want to go through it. We want to go up and up, right up on the inside of it. Okay, guys, so let's get into those initial stretches. Okay, guys, so for the initial one, it is super simple. All we can do here is place an arm, almost like you're going into a chest stretch. Try and get the base of the fingers on the wall or whatever you've got close to you. Your hand's going to be shoulder height. And all we're doing here is rotating out, and you should feel a stretch go all the way from the front of the shoulders down to your arm. Now, once we're in this position, we can apply, and this is 5% effort, so barely activating, a little bit of pressure, pushing into that hand, so pushing into whatever we've got the hand propping up against. And then after 5 seconds of pushing, we're going to breathe out and relax. So switch everything off on that breath out. So we're going to do 6 cycles of this. Follow the breath. As you breathe in, a little bit of pressure into the arm. There shouldn't be any pain. If there's pain, you're not ready for this little push phase. And as you breathe out, relax. Try and rotate out a little further. Remember that stretcher should always be comfortable. You shouldn't be out here tensing, being like, oh my God, my shoulder feels like it's going to pop off. We're going to get there eventually and improve that mobility, but we don't get there by forcing it and causing pain. Okay, guys, so the next one is also a stretch. It's a little progression on the one we just did. And all we're doing here is placing the the palms on a table or a bench top or whatever we've got, dining table, whatever we've got around us. And we're going to try and press the heels of the hand into that table. Now, if this is a strong enough stretch for you, you should be feeling a lot through the forearms and a little bit through the bicep area. So we're trying to open up all the front of the arms here. If this isn't enough and you want to increase your stretch, we're going to press the heels of the table in a little harder. And then from here, rock the body back. For me, this is my limits. For you, you might be able to go back a little further. But with this one, we're just trying to relax. So try and relax into the stretch. We're going to hold this for 40 seconds. And I want you to focus on the breath. So if you just focus on each time you breathe out, we're trying to relax whatever is the tightest part. Maybe the forearms, it may be the biceps. But as you breathe out, just try and relax this as much as possible. So in through the nose. And then as you breathe out, relax. It also helps sometimes to close the eyes so you can really zone in and focus. 40 seconds here, and you can do this twice through. Okay guys, so for the next one, we are going to use what we call a fascial blade. These are extremely cheap. You can get them for $15 on Amazon. A little bit of cream. If you don't have any anti-inflammatory cream at home, you can use olive oil. Coconut oil works really, really good. And all we're gonna do here is start to work a little bit at releasing all those trigger points and try and restore some range of motion in the bicep. So follow along here guys and make sure there is no pain. So we're gonna go up into the zone, but I want you to really focus on the lower portion of the bicep as well. So we're the whole bicep, which sort of covers this region here. We're getting a lot of cream over. Going to rest the elbow on a bench top or a bed, whatever we've got in front of us, with this little fascial blade. We're gonna really light, so it should only be 20% effort. We're not pushing as hard as we can. That's not what this is designed to do. But we're going to just start working through here a little bit. So for the first minute, we're just trying to relax this arm, let it drop onto the table, and there shouldn't be any pain. We don't want to go up into the site where if you're feeling pain up here, we don't want to be on the site. So we're going everything kind of below and trying to free up the rest of the muscle belly. But there shouldn't be any pain. We're just mobilizing this, getting it all warmed up for this first minute. Now, after this first minute, what we're going to go into, keeping this elbow in contact with the table, we're going to slowly start to lift that elbow up while we're still working through with that fascial blade, and then slowly down. So we're just going to do 5 repetitions here, and it should be about 10 seconds up, 10 seconds down. So keeping it slow, keeping it controlled, 10 seconds all the way up, working through that bicep tendon, and then 10 seconds all the way down. That's good. I'll give you a little side on view for this last one. So same thing again, 10 seconds up, there shouldn't be any pain. Keeping it really light through the fascial blade, and good. You shouldn't be flexing your bicep either, don't try and show off. And slowly dropping down from there. Good. All right, so once we've done the 5 repetitions, I know that wasn't 5, but we're gonna get into the next one, and the next one is gonna be a little deeper. So that was more superficial, and the tissue on the top. We're gonna get a little deeper with this one. All right, so same thing again, elbow into the table. We're gonna go almost that pincer grip, so thumb and index finger. We're gonna start from the top here. As we straighten out, I want you almost grabbing and pulling the bicep down. So we're gonna go all the way to the top. If you can get that palm touching the front of the shoulder, do so. We're gonna pincer grip it. And as we straighten, you can see my arm slides down. So we're really trying to release all those little trigger points and we shouldn't be tensing the bicep as well. It should be a nice, soft, fleshy muscle, relaxing all the way down. Once again, there shouldn't be pain. And with this one, we're not kind of grabbing up in the sore spot too much, but we are doing this, guys. We're gonna go up to 6 or 7 reps with this. Honestly, if you want to go more, it can often work a little better. You can't overdo this one too much. So after that 6 or 7 reps, keeping it really slow, what we're going to do, and you've probably felt already, there's probably been a few little tender or sore spots in there. So we're gonna have a little play around, try and find if there's a few sore spots. If we do find them, I've got one right there. We're gonna get the thumb into that sore spot, and it should be pretty tender. From here, once we've found the sore spot, we're going to do 5 very slow, all the way up, all the way down. So keeping it controlled, same thing. I want you to focus as you use your breath, try and relax as much as possible through this bicep. I don't want you tensing because that thumb's not gonna get through the tissue. So 5 reps here, and by the end, we should feel a lot lighter through the front portion of this arm. So really, we've done our stretches now. We've done a little tissue release work, which should be feeling amazing. Guess what we're about to get into? That is the strength, and that's what's gonna keep us going into the future and hopefully get back into whatever sports or activities we love doing. Okay guys, so for the next one, we are using a light to medium TheraBand. These are super easy to get. Once again, I'll leave a link. You can get them on Amazon for super cheap. So what we're going to do here, you can cut some of your TheraBand, so it's about the length. If you were to straighten your arms out like that, it's about the length of both arms straightened out. Now, we are going to stand on one end of the TheraBand, make sure it doesn't slip out from under your foot. We're going to wrap the TheraBand around your hand like so. And all we're doing here, we're going to slowly start to come up. Now, once we get, and because this is early phases, we don't want to add too much through this bicep tendon, and in this position, there should be 0 pain. We're going to go into what we call an isometric hold. So this is where we just come up to this portion here, and we're just holding here 5 seconds. And then the most important phase here is the down phase, so keeping it controlled. So if you can go higher than that 90 degrees without pain, feel free to start to lift. But as soon as you feel pain, you're going too fast. So make sure that you're not feeling any pain. So 5 seconds, slowly dropping. As we do this, I don't want to see your shoulders coming forward. So we want to be doing this from a perfect posture where you're puffing your chest out, your neck's up nice and tall, your spine straight, and we're achieving this in very good posture. Okay, so after your 6 repetitions there, guys, what we're going to go into, we're going to choke that band up just a little bit more under our feet. We're going to wrap the band around the hands, and from here, you've probably seen these before. I'll do them side on for you, but the bicep curl. So getting back into it, elbows locked into the side, not moving whatsoever, trying to squeeze that elbow into the ribs, coming up as high as we can get the band going. Trying to, as we get to the top here, pull the shoulder blade back, open up the chest, hold here once again for 5 seconds. And then the most important part of this phase is to slowly drop down and release. Once again, not releasing this elbow, keeping the elbow locked into the ribs. So 6 reps here. We're coming once again all the way up as high as possible. If this is too easy, guys, what you can do is choke the band up a little bit more through the foot, so there's more tension. That's the best thing about TheraBands. You can make it that little bit harder, and then eventually we're gonna substitute dumbbells in. So with the dumbbells, I'm literally starting with a 5-pound weight with these ones today. If you've got a 2 or 3 pound weight, you're better off starting with that. To start off with, we're going to try and tuck the ribs, tuck the tailbone, head up nice and tall, puff the chest, and we're lifting just to 90 degrees once again. Holding for 5 seconds with the weight, slowly down. So same thing here, guys, 6 reps, that little hold at the top. This is gonna be a little harder with having the free weight. If you can go a little bit beyond the 90 degrees, feel free to do so, but we don't need to go too far past that to get the benefits. So we're doing 6 reps here, trying to get that 5-second hold up once again. And as you can guess, the last one we're doing is that bicep curl motion. So elbow locked into the ribs, palm facing forwards. We're trying to get that dumbbell all the way up to the bicep if we can. A little hold at the top, and then very slow. The release is always super slow, all the way down. So once again, slowly coming up, keeping things slow and super controlled. Arms into the front of the shoulder. And after 5 seconds, remember to like, subscribe, Write in the comments section what you want to see more of, and we'll keep these videos coming. I'm enjoying making them, so I hope you're finding benefits out of watching them. All right, take care guys, and we'll see you again soon.